remember that any kink that goes on in the kinetic chain, kinetic means movement, any kink that goes on in the kinetic chain, whether it be through the spinal column, whether it's in the fascial network, is going to show up as a kink somewhere else. It's going to show up as a compensation somewhere else. And so what we've got to do is we have to restore function. Function precedes structure. You can look at all the anatomic landmarks, you can put them against your grid chart, you can find the low shoulder, but it doesn't tell you anything unless you see what happens during gait. Gait is what we were designed to do, to move from one place to another. Gait is the important thing, and so we have to restore proper function during gait if we're going to get rid of the low back, hip, and leg pain that this video is dedicated to. Okay, so that's the first test that I like to do on the people. Just bring them in and look what the curve looks like. It's supposed to be doing this, right? Each side. All right. The second thing that I want to do, and I'm going to have to do this for the camera's angle, I'm going to come in like this, and I'd like for you guys at home to do this standing on yourselves. Keep your belly out so that you're in extension. Put your thumbs on your transverse processes. So in other words, it's very close to the spine. You can take your fingers or thumbs, whichever is easiest for you, and then you just side bend your spine to the right and see if it fills up on the left like it should. And then go back to the left. Ah, there's where his problem is. He's not filling up when he comes to the left. I couldn't see this as well visually, but now I can feel it. Okay, go back to the right. When he goes back to the right, it's filling up nice. It's rotating. In other words, when he's side bending right, it's rotating left, and I can feel it here. And it's nice and soft here. But when he goes back to the left, still look how soft it is over here. Not filling up. So it's not wanting to rotate.